In line with the 7th National Development Plan and the Sustainable Development Goals of Leaving No One Behind, Zambia Red Cross Society implemented the community-based health and resilience project in Petauke district, which is in the eastern province of Zambia. Petauke district has a population of 241,056. In implementing the program, the society worked with the main stakeholders and implementing partner in the district, which is Ministry of Health.
For this goal to come to fruition, it calls for a multi-sectoral approach. I think government alone cannot manage to ensure that this is done. So we need the collaboration of key partners in the sector to ensure that maternal deaths and child mortality actually comes down. I think that's how Red Cross has actually been key in ensuring that this actually comes to fruition.
CBHR project is a project that has been implemented in Eastern Province, in particular Petauke district. The project began in 2019, that was in April, and it should be finishing in 2021 December, which is a 3 years project. The main goal for this project is to reduce maternal, neonatal, infant mortality and morbidity within the communities of Petauke.
The program has been implemented in 5 facilities which include Chikusu, Ndambwe, Makonde, Muzenje, and Kalumbi.
The 4 facilities then were based in Petauke, and to be in particular, Chikova is the facility that was based in Lusangazi. But with the realignment of the district, all the facilities currently in Lusangazi.
And I think we've partnered very well with Zambia Red Cross Society in the CBHR project in ensuring that Legacy Goal number 1 in our National Strategic Plan 2017-2021 of reducing maternal mortality and child mortality comes to fruition.
In Jacob Village, which is a subzone of Chikusi Village, the women have been empowered with loan grants amounting to 1,000 kwacha, which has assisted many with income-generating activities, enabling them to overcome the challenges that they faced and greatly assisted to uplift their standard of living. The National Society worked with partners such as Ministry of Community Development and Social Welfare Volunteer, Imelda Daka. Social Welfare Department has the database for families and individuals who are vulnerable in the community.
Vanabwera va Red Cross va tuonkanisa pamoja na wazimai ma beneficiaries vanabwera vavapasa loans ya 1,000 kwacha. So wazimai vanamba business yao naona kuti yaenda bwino yasiyana na mamene nzeli kumbuyo wazimai at least wachako develop manje mu minzi muno, because kudala mzimai nzongo nkhala chabe achitaka business sikaenda na bwino lero achita mailo kafa nditi achita so chabe, but pamene anabwera pasiwa ndrama iyi 1,000 kwacha na Red Cross naona kuti at least venangu wachitako bwino kwambiri futi wachita bwino.
The beneficiaries of the income generating activity program were trained in cash and business management, equipping them with the necessary financial and management tools before receiving the cash grants.
Unabwera va Red Cross anabwera vaniu uza komine ninga pangire ma business akapaja tinapita kwa workshop tinashita 3 days mapunziro mamene tinga pangire ma business yatu pajadashita mapunziro anabwera ali pasako thandizo ya ndalama kuti niyambe business keneze vipo yambira pamene ana nipasa vaja anthu namba oda tomato ayambo ogulisa sanambo ogulisa tomato yanga ija napeza muthandizo nthandiziramo vana nigulamo na sopo mafuta ndiyo vosa kulibe vamene vinivuta
ayi kupaendera mapeni itola peni yamba business koma napindulira mu chifukwa na chitamo vitu vininji panganda lazikulu ya kunyeshera vana kugula vintu papanganda nagula moto malata na dindisha moto manganda. okopano sonika lwisilenzesha ikalwiselenza.
Safe Mother Action Groups, SMAGs, with the support of Netherlands Red Cross, were trained on how to utilize locally produced crops in order to enhance the nutritional value of foods given to children. In introducing health and care activities, community-based health resilience program included the component of community-led sanitation to the communities in the district of Petauke.
The community has been so good and so supportive to the project. This has been seen in a few trainings that we had with community leaders and also their involvement. Community leaders actually have been in the forefront, for example, in CLTS, to ensure that almost each and every household has a toilet.
The results have been very positive, as the recipients of this component appreciated the initiative by Zambia Red Cross Society. An example being Penala Tembo, who is a resident in Dambwe community.
Ukondo wanaonamo wabwino mu Red Cross kankhalidwe kati lomba so patena Red Cross nikabwino kasiyana na kuvuluku kale tenzozi balini kunkhala na kukumba vinyalala tenzozi balini matoileti tenzozi balini kunkhala na matoileti pa Red Cross pechiwera betiphunzisa kunkhala na matoileti na ukondo wapang'anda.
In Nyamiwe village, Zambia Red Cross Society built the capacity of community-led total sanitation champions by training them in water and sanitation hygiene. These in turn trained the communities in their respective home locations.
Tenzokambisirana chufunika kuti timange matoileti wenango anamvesa kuti toileti nyabwino tentimange koma enzije yo tintirira chabwa kuti kukamba wenango sibenzo mvesa. So pamene kunabura wa Red Cross nikaganiza bwino I think tili nawo na 3 years makamaka meni lingako pamene vankhala kuno kuti punsi pamene vanaenda kuti avapereka ku ma training nobura yambo tiphunzisa kuyangana mbali ngako ya matoileti na kuyangana ngako za umoyo.
In project and program implementation, Zambia Red Cross Society collaborated with partners such as local rural health facilities and local district authorities.
We are working with the Red Cross, Zambia Red Cross Society. They are implementing a project called CBHR, Community-Based Health and Resilience. They are supporting 5 health facilities in Petauke and Lusangazi. Many they implement their activities through MNCH, which is maternal and child health. They've helped us to train SMAGs in all the 5 health facilities. SMAGs is Safe Mother Reduction Groups. It's a group of men and women who works in the community to encourage pregnant women to go for antenatal early, and those who have delivered to go for postnatal, and in case of any complications, they advise them to go to seek medical health as early as possible.
The Red Cross project, community-based health and resilience project, has come and it is operating from our area within my sub-center, that is Chikuse sub-center. It is a project that has got many components, but particularly of interest is the women empowerment component, which targets lactating mothers and pregnant mothers, trying to empower them with soft loans, as it were, using a revolving fund that was initiated by Red Cross. So the Red Cross has partnered with the Department of Community Development in this endeavor. And as a department, our role has been mostly to provide support in form of training of beneficiaries in life and business skills.
Zambia Red Cross Society was able to rehabilitate boreholes in 25 communities, one of them being Lusangazi village. Water committees were formed and trained. therefore enhancing sustainability of the boreholes by having each household contribute a monthly fee. The water that is now being collected is able to provide animals such as cattle, pigs, ducks, goats, and other livestock with drinking water.
Tikankhala pano tukumana pamozi kusonkhesha ndalama izo ndalama tulipira pe household 100 kwacha so yapa kutumba apa tiko na 80-70 so zila ndalama zila tuita tiboho ngati yaonongeka nongo kuyatia buku kwala nona ndalama zili kunothandizika paboho.
If you look at the problems, the major problems that came out from the analysis that was done in terms of the problems that the communities are facing, water was ranking #1 in terms of problems that the communities were bringing out to say these are the problems that they are facing. So to have partners coming on board to help in terms of trying to bridge the gap in terms of water supply to our communities is quite a very good move that we really appreciate as a council because we may not have full funding, but with the help of partners we're able to provide the needy resources to the communities.
In uplifting the social well-being of communities, Zambia Red Cross Society, with the support of Netherlands Red Cross Society, constructed a mother's shelter at Sasu Rural Health Center.
The community-based health and resilient project that we are seeing here today was launched on the 23rd of October 2019. This was done with the support from our all-weather partners, the Netherlands Red Cross. So the Zambia Red Cross was given the mandate to implement this in a time span of about 3 years. This project has the following components: basic health, WASH, and women economic empowerment. These components have been implemented in selected communities and health facilities in Petauke district of Eastern Province.
As Netherlands Red Cross Society, we will continue to support Zambia Red Cross to reach out to more communities, not only this community, with more projects that can also reach out to the most vulnerable people in those communities. I would also like to just mention that the funding that has supported Zambia Red Cross to come up with this structure came from women groups in Netherlands.
Some time back, what was happening, especially when it is rain seasons, since we have some neighborhoods which are very far, 14 kilometers and 15 kilometers, some such as Zanji and Kope. So during rain seasons, they used to move from their villages coming at the facility to wait for the mother to deliver. But the only problem was that there was no building for them to stay as they are waiting. Hence we are putting them in the ward. When the ward is full, some of them were putting them in the same labor ward. So it was a challenge. But for now, since they've given us the building that these mothers can use to wait as they are waiting for delivery, indeed we're expecting to have a high number of deliveries, reduction in home deliveries, and improved RAMCA services.
In restoring hope, life, and the well-being of communities, Zambia Red Cross Society, with the support from Netherlands Red Cross, have been able to bring dignity to communities, enabling mothers to deliver in a clean and safe environment, provide safe and clean water, bring resilience through income-generating activities, and in addition, to uplift the standards of health and hygiene through improved sanitation.
And in terms of technical support, I would also want to thank the Netherlands team. They've been there for us to provide some technical support. Where we could get to lag, we could get to ask them, and that support could be provided to us. So thank you very much, and my prayer is that you continue with the same spirit, not only to me who is on this project, but to also other project officers, because we are a team, and together we can change the world. Thank you.